happy Sunday morning. Happy St. Patrick's Day, everyone. Many of us are feeling the hint of spring in the air. That comes with more time outside, more time in the sun, and allergies. Here to go over some health headlines is NewsNation medical contributor, board-certified cardiologist, and managing partner at Prevent Clinic, Dr. Dave Montgomery. Dr. Montgomery, welcome back.
Good morning to you, Hena.
Let's start with Christie Brinkley, revealing she was diagnosed with a carcinoma, a skin cancer, one of the most common types of skin cancer, basal cell. What should we know about this, Doc?
Yeah, I really appreciate when celebrities use their platform to bring our awareness to this. Basal cell carcinoma, one of the most common forms of cancer of the skin, and it's caused by UV light damage. What I want people to kind of hone in on is the signs of basal cell carcinoma, because it doesn't really give you much symptoms. There's no pain, there's no other symptom like it. One of the key signs is a rash that is discolored, whether it's a pearly color, a lighter color, a darker color, that has a dip in the center. When you see that, you want to go to a board-certified dermatologist and ask them about that particular lesion. There's another one. Any kind of growth or scaliness around your ears, although not exclusively, but certainly around your ears, you want to be thinking about basal cell carcinoma. Let me talk to my dermatologist. And then the last one is on any part of your body, a sore that you can't explain that doesn't heal. You want to talk, that's not normal at all for anything. And you certainly want to talk to a physician about that. The nice part about basal cell carcinoma, it is one of the easier ones to treat if it gets to it early. If you get to it early, it's treatable.
We have so many subjects to get to, but before I move on from this, so many people think sunscreen is enough prevention, but that doesn't seem to be the case according to new studies. Tell us about that.
Yeah, exactly. And certainly people who are more susceptible to skin cancers should be looking at things like covering themselves, right? Covering yourself, a little bit longer clothing, although that's not so tenable in the spring and the summer, using screen and reapplying the sunscreen, but then covering, right? Eyes and hats and things like that can help you avoid some of the cancers that come from UV damage, not just basal cell carcinoma.
All right, good to know, Doc. Thank you. Spring just around the corner. It is allergy season. It's in high gear. Why are people dealing with allergies so much earlier in the year? And what are ways to ease those symptoms that so many of us suffer from?
Yeah, no, I'm bracing myself right now for it. It is one of those things that, it feels like we just can't explain why it's happening. But here's the deal. I ask my patients who have really bad allergies to go through a couple of things. Do you have an antihistamine that you can use? Histamine is one of the things that gives you the itchy, scratchy, runny nose. I want people to be thinking about nasal steroids. I don't think people use nasal steroids as much. You're going to ask your doctor, can I use the nasal steroids that decrease the inflammation that causes some of these symptoms? And then for your home, because one of the things that's very tempting when the spring comes, let's fling open the doors and the windows. Make sure you have a HEPA filter in your home that sort of filters out some of these things that can give you trouble.
Great advice on that, too. Moving on. I told you it's a busy Sunday, sir. So the CDC in states like here in New York, New Hampshire, they're sounding the alarm about ticks this spring season. I just pulled one off my dog 2 weeks ago. We're only in March. What do people need to know about ticks and Lyme disease?
Yeah, that's the thing. I'm glad you said that. Dogs can carry ticks. There are some really common ticks that sort of live in certain parts of the country, but there are ticks throughout the country, and they typically live in grassier, woodier areas. And I just learned this, that a tick's life cycle is 2 years. And before it becomes an adult, Hena, it can still infect you, right? So even the younger ticks. And what ends up happening, particularly with something called Lyme disease, I think we've all heard about Lyme disease, which mainly lives in the northeastern and the mid-Atlantic states, is you get this little rash that we call the bullseye. You get a little mosquito-looking bite, and then around it is a circle that advances. When you see that, you want to be thinking, am I having muscle aches and fevers? I want to go to my doctor to get antibiotics, because Lyme disease and some of these tick-borne illnesses are bacterial. It can be fought with antibiotics.
2-year lifespan. Did not know that. Dr. Dave Montgomery, all advice I'm taking into the spring season. Thank you so much.
Absolutely. Great to be with you.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.